Thyroid cancer symptoms. 5 signs you need to know. What is thyroid cancer? Thyroid cancer affects the tissues of the thyroid gland, which is located in the front of the throat, below the thyroid cartilage, otherwise known as the Adam's apple. The thyroid gland is responsible for producing several important hormones, such as the thyroid hormone, which is involved in controlling body temperature, weight, energy level, and heart rate. The thyroid gland also produces calcitonin, which helps the body use calcium. According to the American Cancer Society, over 56,000 people in the United States are diagnosed with thyroid cancer every year. Compared with other common types of cancer, approximately 80% of cases occur in people who are under 65. Also, women are about 3 times more likely to develop thyroid cancer than men. Types of thyroid cancer. There are several different types. Papillary carcinoma is the most common type, accounting for approximately 80% of cases. Papillary carcinomas are slow-growing, differentiated cancers that develop from follicular cells and can develop in one or both lobes of the thyroid gland. This type of cancer may spread to nearby lymph nodes in the neck, but it is generally treatable. Follicular carcinoma is the second most common type and accounts for approximately 1 out of 10 cases. It is found more frequently in countries with an inadequate dietary intake of iodine. Hürthle cell carcinoma, also known as oxyphil cell carcinoma, is a subtype of follicular carcinoma and accounts for approximately 3% of all thyroid cancers. Medullary thyroid carcinoma develops from C cells in the thyroid gland and is more aggressive and less differentiated than papillary or follicular cancers. It accounts for approximately 4% of all thyroid cancers. Anaplastic carcinoma is the most undifferentiated type, meaning that it looks the least like normal cells of the thyroid gland. As a result, it is a very aggressive form of cancer that quickly spreads to other parts of the neck and body. It occurs in approximately 2% of thyroid cancer cases. Thyroid cancer symptoms. What are the symptoms of thyroid cancer? The most common early sign is an unusual lump, nodule, or swelling in the neck. If you notice a new or growing lump, you should see your doctor, who can run additional tests to identify the cause. Most nodules on the thyroid are usually benign, but it is important to have any unusual growths examined by a healthcare professional. Other possible symptoms include neck pain. In many cases, neck pain starts in the front. In some cases, the neck pain may extend all the way to the ears. Voice changes. Experiencing hoarseness or other voice changes that do not go away could be a sign. Breathing problems. Sometimes thyroid cancer patients say it feels like they are breathing through a straw. This breathing difficulty is often a symptom of the disease. Coughing, a cough that continues and is not related to a cold. Trouble swallowing. A growth or nodule on the thyroid gland may interfere with swallowing. Medullary thyroid cancer symptoms. A nodule, lump on the upper part of your thyroid gland. 75% to 95% of people have this at diagnosis. Swollen lymph nodes in your neck. 70% of people have this at diagnosis. In rare cases, an enlarged thyroid nodule can cause hoarseness, difficulty swallowing. Breathing issues. According to the Cleveland Clinic, medullary thyroid cancer often shows symptoms long after they develop, as the tumor remains small for an extended period. Papillary thyroid cancer symptoms. The primary sign of papillary thyroid cancer, PTC, is a painless lump or nodule on the thyroid gland. According to the Cleveland Clinic, papillary thyroid cancer typically does not cause any additional symptoms. In rare instances, you might experience pain in your neck, jaw, or ear due to PTC. If the nodule is large enough to compress the windpipe or esophagus, it could lead to difficulties with breathing or swallowing. What are the risk factors for thyroid cancer? Although the causes of thyroid cancer are still being investigated, there are certain factors that may increase an individual's risk of developing the disease, gender, and age. Thyroid cancers occur approximately 3 times more frequently in women than men, although the reason for this difference is unknown. Women also tend to develop these cancers at an earlier age, 40s to 50s, than men, 60s to 70s. Low iodine diet. A diet that contains very little iodine has been associated with an increased risk of follicular thyroid cancers. This may explain why these cancers are seen less frequently in the United States, where iodine is added to salt and other foods. Radiation exposure. Radiation, including the kind used for certain medical treatments, as well as fallout from nuclear weapons or power plant accidents, can increase a person's thyroid cancer risk. In particular, childhood exposure carries a greater risk of later developing thyroid cancer than exposure as an adult. Hereditary conditions. Certain inherited genetic abnormalities have been associated with the development of different types of thyroid cancer. Even if no known inherited syndrome has been identified, thyroid cancer in a first-degree relative, such as a parent or sibling, raises your risk of developing thyroid cancer. Immediately discuss any thyroid cancer symptoms you are experiencing with a doctor who can help you understand what condition, if any, you may have. Doctors often take a complete medical history to gauge your thyroid cancer risk. If you have additional risk factors, your doctor may recommend other tests that will help them better evaluate your concerns. What are the stages of thyroid cancer? Often, T&M staging can be simplified into 4 stages, 1 to 4. For some cancers, there is also a stage 0. Larger numbers mean the cancer is more advanced and is generally more difficult to treat. Here are the stages of thyroid cancer, according to MD Anderson. Stage 0, thyroid cancer reflects the presence of abnormal cells that have not spread to tissue that is immediately nearby. Stage 0 is considered precancerous, though it could become cancer in the future. This stage is also called in situ, which means in its original place. Not all cancers have a stage 0. Stage 1 thyroid cancer symptoms are typically small and confined to the area where they began. Stage 2 and Stage 3 cancers have spread to nearby tissue and/or lymph nodes. Stage 4 cancer means the thyroid cancer has spread to distant areas of the body. This is also called metastatic cancer. Stage 4 cancer often cannot be cured, but can frequently be managed like a chronic disease.
The information in ACE Healthline channel is for educational purposes only, compiled from open sources, and does not substitute professional medical advice. Always consult your doctor for any health-related concerns. If you're experiencing any of these symptoms discussed above, please consult a healthcare professional or your doctor immediately. Let us know where you're watching from, and don't forget to subscribe and turn on notifications to stay informed on health topics that matter. Thank you for watching.